Fair enough. Another, I think, common issue that we hear about and experience as patients is this idea of bowel obstructions after the surgery. And one of the questions was whether there's anything that, as a patient, you can do proactively to try to prevent bowel obstructions, whether it's drink 10 liters of water a day instead of 5, or exercise and stretch more, or is there anything?
I think if somebody comes up with that answer, they'll, that'll be a New England Journal publication.
Nobel Prize.
Standard of care, and, I don't know of anything.
No, I don't know. My partner, Dr. Barlow, always recommends that people swim, but I don't really know where he gets that from. Just the movement seems to soften things up on the inside. We have a lot of problems in the first month or two, digestive issues, and then it doesn't seem to be a huge issue as long as the disease is under control. I mean, compared to the regular population of patients who have major abdominal operations. So.
Now, there are some chemotherapy agents that are more actually, mitomycin C is used by the ophthalmologist to decrease the adhesions on the cornea. So actually mitomycin is supposed to be it's an antibiotic, by the way, you know. So interestingly, when we reoperate, usually the second time is not as bad as the first time when we are using mitomycin. When we have used other drugs like adriamycin, which are more, toxic for the tissues, you'll see more adhesions and more difficult operations. So, but the issue of intestinal obstruction really is a combination of multiple adhesions from previous surgeries, including your own surgery. And happens a lot in pelvic surgery, and really everything that you can imagine have been used. It goes to the time where people used to put a long tube. And again, it goes to my training. We used to have to feed a tube to make sure the bowel was all organized in a way. We even used to suture it together, if you believe it or not, so that way it wouldn't kink. It of course didn't work. Then we went to use something called dextran, which was is a solution that is kind of it's slippery. The idea that you do that, and then we went now. There's something that actually is sold. It's called Ceprafil, which is a wall of cellulose that you use in the abdomen. The problem with the high peg, there's so much fluid slipping from everywhere that before you are closing, this thing is dissolving everywhere. Have been used all around areas of ostomies when you have to go back down to do an ostomy. Actually may help to make that operation a little bit easier. But yes, no one knows, and when I see obstruction, I start worrying about the possibility of recurrence.
Right, it's more
which
indicative of
is
disease
not necessarily, but it's a little concern. But it would be a Nobel Prize if someone comes out with the idea.